the main difference between VT and the SVT. The ventricular tachycardia and supraventricular tachycardia with aberrancy. The most common confusing diagnosis at the time of emergency or at the time of we are dealing in the critical care. As I doing the work in the internal medicine, so many time we and the emergency we just confuse between the VT and SVT. Main difference I will talk about in next 10 to 15 minutes. The how we differentiate between the VT, ventricular tachycardia, and SVT. The main difference is the for example, before we progressing the only difference between SVT and VT, when we see the ECG of the broad complex tachycardia, the at least three thing in our minds, these are the VT, SVT with aberrant and conduction due to the bundle branch blocks, and the SVT with aberrant conductions to the WBB syndrome and VT. Three are the main differential diagnosis for the broad complex tachycardia. At least we differentiate broad complex tachycardia. That means the difference between the QRS complex is the more than 3 small square, or more than 120 millisecond is the broad complex tachycardia. First we discussed VT, then SVT, and then SVT with the aberrant conduction in the WBB syndrome. The ECG that feature suggesting the VT. What are the ECG feature that we can mainly diagnosed? We mainly suggest the patient is on VT. सबसे इम्पोर्टेंट बात है कि अगर पेशा में कन्फ्यूजन भी है तो वी जस्ट फॉलो एक्सेप्ट अदरवाइज VT. अगर कोई भी ब्रॉड कॉम्प्लेक्स टैकीकार्डिया आ रहा है तो वी जस्ट फॉलो द पेशेंट विल बी VT. The main feature of the ECG that suggests the VT, the absence of typical RBB or LBBB morphology. Patient ECG में there is no LBB or RBB morphology that suggests the VT. The RBB or LBB morphology, we see the rabbit ears in the V1, and or we also say the M pattern in V1. This is marrow. That means if B1 have the M pattern, that is RBB, right bundle branch block, and reverse is Williams LL. That means if there is a W pattern in the V1, that says the left branch block, that's suggesting the LBB. These are more suggesting the feature of SVT with aberrancy. Or in absence of this feature, we are more suggesting the diagnosis of VT. First point. Second is extreme axis deviation. That is northwest axis. For axis deviation, that means ki the extreme axis, we say the patient, if the diagram of the for axis, this point suggests the extreme axis deviations or northwest axis. For this, we see the QRS is positive in AVR. AVR lead is around the opposite to second lead. This is second lead in the 60 degree. The second lead, and this is the AVR. That means if AVR is positive, the more उसका जो vector होगा, there will be something here. AVR is positive and negative 1 or AVF. That means opposite to this one. 1 AVF का opposite होगा, that means this is, and 1 का opposite, that means this one. Ultimately vector will be there between the 180 to 275. This is the vector for extreme and the northwest extreme axis deviation or northwest deviations. That more suggesting the feature of the. अब यहाँ कुल मिला के अगर हमें देखा पेशेंट का AVR अगर पॉजिटिव है, सेम टाइम 1 और AVF जो है वो सारे नेगेटिव हैं, द मोस्ट सजेस्टिव फीचर ऑफ द this one, the VT. Third thing is the very broad complex tachycardia. For broad complex tachycardia, we see the more than 4 centimeter. That means the mild broad complex more than 120 millisecond, and for very broad complex tachycardia, QRS complex, more than 160 or more than 4 small square. For VT, it not be narrow QRS. That means not narrow range wide QRS. That means in the double syndrome, we generally see the QRS wave, the QRS complex just 120. That means just 3 small square. This is narrow range QRS. But in case of the VT, if we see this ECG in the emergency, that means very wide QRS, more than 4 mm, 4 small square, then we suggesting the more feature of the more likely to VT. Third thing, AB dissociation. There is no association between the atrioventricle. That means P and Q are different rates. The more suggestive the ECG of the peculiar feature for the VT. P wave are often superimposed the QRS complex and may be difficult to discern. That means there is no association. Many times there is no association of the P wave finding in the P or the QRS complex. We see this diagram. The P waves. This is P wave. This is P wave. And some here this is P wave. So there is QR, no association between the P or QRS. That is suggestive of the AV, the VT. This is 4th point. 5th is the capture width. What is the capture width? Capture width is when the SA node transiently captured. Otherwise, the rhythms is by the ventricle, but suddenly SA nodes transmit the weight. That's called capture weight. And there is a patient is producing a QRS complex of the normal duration. That means narrow QRS complex. This is the this is capture weight. This one capture weight, that means it is beat by the SA node, so that the always narrow. But in the fusion weight, this is a fusion of the atria or ventricle rhythm. That case there is a wide. One thing, fusion weight they occur when the sinus and ventricle beats coincide, produce a hybrid complex. This is wide. These are the feature of the VT, capture weight, fusion weight, AV dissociation, very wide complex, and north axis, extreme axis deviation, and the absence of the RBB or LBB. These 6 feature more suggestive to the feature of the VT. Fourth one is seventh is a positive concordance. That means ki from V1 to V6 all positive or the complexes. That means all are R. This one. These are all positive. That means no, there is RS pattern. If the RS pattern is there, that means this is RS pattern. That more suggestive the SVT or feature of the SVT with aberrancy. But in case of the only positive concordance, either is a concordance. These suggestive the VT. In same with the negative concordance, from V1 to V6, all negative, no RS pattern. This one, this feature suggestive the VT. These are the 7th and 8th point. This is 9th point, or negative positive is the same point. Then is 8th point for the RSR complex with the taller left rabbit ear. It is very important. When we see the marrow pattern or the rabbit ear pattern, always the right ear is a larger. Right ear is larger than the compared to left. This is in case of the RBB. In RBB, where the right is larger. But in case of if in the BT, the left rabbit is taller left rabbit ear. See this. This all the pattern of the left is taller and right is smaller. In that cases, we suggest the feature of the VT. See, the 9th point is a Brugada's sign. Brugada's sign is very important, and Josephson sign. In the Brugada sign, the distance from the R wave to nadir of the S is more than 100 millisecond. In the lead 1 to B6, कहीं भी देखेंगे B1 to B6 में अगर इसका जो from the R nadir means that means the deepest point of the R wave, S wave. This one, this is RS interval. This is RS interval. For Brugada sign is RS interval. For RS interval, that means from the R wave, this is R wave starting from the R wave, and the deepest point of the S. This is nadir of the S. It is if it is more than 100 millisecond or more than, that means 100 millisecond more than 2.5 small square. That's called as a Brugada sign. Brugada sign is a suggestive of the VT. Okay, it is important. Same is a Josephson sign. There is notching or slurring in the near the nadir of the S. If in the S deflection or S wave, there is any deflection or there is notching or slurring, this slurring wave, yes, this one near the nadir or near the S wave, there is deflection or the slurring or the notching, called as Josephson sign. This 10 point is very important for help in diagnosis of the VT. From starting, we just see 10 point. First is the absence of any WB or any bundle branch block. Second is extreme axis deviation. Third is very broad complex tachycardia, that is more than 4 small square. Fourth is AB dissociation. There is no P and QRS complex synchronization. And 5 is capture weight. 6 is a fusion weight. 6 point is, and 7, 8 point is a positive concordance or negative concordance. या तो सारे पॉजिटिव होंगे या सारे नेगेटिव होंगे, कोई RS पैटर्न नहीं होगा। दैट्स सजेस्टिव द मोर लाइकली VT। 8 and 9.8 इज द RR डैश पैटर्न, जो लेफ्ट का ईयर होगा हमेशा इसमें वो बड़ा होगा। नेचुरली बंडल ब्रांच ब्लॉक, दैट मीन्स जो नेचुरल नॉर्मली होता है, राइट इज ऑलवेज राइट, राइट इज ए राइट, याद रखने का, राइट इज राइट, दैट मीन्स राइट हमेशा नॉर्मली बड़ा होता है, टालर ईयर होता है। बट इन अपोजिट, दैट मीन्स इज डेंजर इन द emergency cases, their opposite happen, that left is taller. For you to remember, left ear is taller, that suggests VT. 9 point is Brugada sign. Brugada sign, that means the RS dash, RS interval from the starting from the R, the R patterns from the R to the patterns showing the this one. This RS pattern is more than 10 more than 100 millisecond or more than 2.5 square. This is a feature suggestive of the VT. This is called a Brugada sign. Same is Josephson sign. Josephson sign, we see there is a deflection, or there is a notching in the S wave or S deflection, or in the nadir of the S wave. This is Josephson sign. 10 points are very important to help suggesting the feature of the VT in emergency situation, that are always differentiate from the SVT or Brugada sign. More important from these, some are basic history point that help suggesting the VT. These are the clinical feature associated with VT and SVT. But we are discussing the likelihood feature of the VT. ये सारे इंपॉर्टेंट है जो कि हमें सजेस्ट करेंगे कि मोर लाइकलीहुड VT। हमारे पास इमरजेंसी कंडीशन है, वी कांट डिफरेंशिएट एक पॉइंट, अगर हमें याद नहीं रहता है 10 पॉइंट अगर, देन 90% चांस में द ओनली बेसिस ऑफ द क्लिनिकल हिस्ट्री 90% चांस में वी आर डिफरेंशिएट on the basis of this feature, either is VT or either is a SVT with aberrancy. If these 4 to 5 feature we met, then we suggest the more likely or 90% chance the patient will be the VT. First is the age more than the 35 year. Patient is older. Any structural heart disease, patient any cardiomyopathy and is important. Any structural heart disease. Third thing is ischemic heart disease. कोई भी ischemic attack आया हो, previous MI हुआ होगा पेशेंट कोई भी coronary artery disease का है, ischemic heart disease का पेशेंट है, पेशेंट को पहले MI आया है, फैमिली हिस्ट्री सडन करेक्ट डेथ की, मोर इम्पॉर्टेंट थिंग्स, किसी को भी अगर फैमिली हिस्ट्री में HOCM हाइपरट्रॉपिक कार्डियोमायोपैथी, कोई भी कंजेनिटल लॉन्ग क्यूटी सिंड्रोम है, ब्रुगाडा सिंड्रोम है, एरिथ्मोजेनिक राइट वेंट्रिकुलर डिस्प्लेजिया हुआ, किसी फैमिली में अगर एक भी फीचर मिलता है कि सडन कार्डियक डेथ हुआ था, या फिर कोई भी फीचर सजेस्ट करा कि इस्केमिक हार्ट डिजीज़ है, कोई भी कार्डियक स्ट्रक्चरल हार्ट डिजीज है, एज ओल्डर है, दीज आर मोर लाइकली टू द VT and more likely to SVT are these 3 points. SVT with aberrancy, previous ECG show RBBB patterns. This is very important. Basic. We always, if we suspecting the patient is VT, if patient having the any medical records, we always ask for the basal ECG, basal ECG to see any previous ECG. If there is any previous RBB pattern or bundle branch block patterns to identify the morphology of the broad complex tachycardia, then we suggest SVT. कोई भी पेशेंट का पहले भी ECG में अगर बंडल ब्रांच ब्लॉक का पैटर्न हो, likely to the SVT with aberrancy. First point. Second point is previous ECG show evidence of double pit syndrome. Same thing. Any ECG में पहले बेसल ECG भी जरूरी है. इसमें पहले बेसिस है, उसमें हमें नैरो वाइड क्यूआरएस, नैरो मतलब वाइड दैट मीन्स मोर देन इक्वल टू 120 है, पर 120 से ज़्यादा नहीं है, अराउंड 120 और 100 to 120. दैट इज दैट दिस double PDO syndrome, delta V, and what the PR interval is shorter than 120. The previous evidence of the double P syndromes and patient with history of the paroxysmal tachycardia and have the successfully terminated with the adenosine and vagus. That means patient giving the history of, patient कहेगा आपको कि हम लास्ट टाइम भी आए थे और पेशेंट का बहुत ज़्यादा हार्ट रेट था, उसको या तो हमने वेगुलर मैन्यूवर किया, कार्डियक मसाज वेगुलर मैन्यूवर किया हमें, उससे बीपी उसका हार्ट रेट कम किया और एडिनोसिन दिया. दैट मीन पेशेंट विद हिस्ट्री ऑफ एसबीटी हुआ होगा पेशेंट को. दीज थ्री थिंग, वन मेन इंपॉर्टेंट इन प्रीवियस बंडल ब्रांच ब्लॉक इन द बेसल ECG, और patient having the double PW syndrome in the basal ECG, or history of the SVT. Three things are more favoring to SVT. Now we see the algorithm. पेशेंट हमारे पास आएगा कि देखिए सबसे पहले क्या देखना हमने, एब्सेंट ऑफ RS कॉम्प्लेक्स. दैट मीन्स कोई भी RS कॉम्प्लेक्स नहीं है, RS सेम R है और S है, नहीं है, देन सजेस्ट VT. ठीक है, कोई भी ऐसा चीज नहीं. इन प्री कॉर्डिलेट में देखिए मेनली नहीं है, VT है, और BT में हमें पता है ये नहीं है, तो क्या होगा, मोरली RR पैटर्न, दैट मीन पॉजिटिव कॉन्कॉर्डेंस या फिर नेगेटिव कॉन्कॉर्डेंस. दी सजेस्टिव फीचर ऑफ द मोर लाइकली दी VT. And first thing, if this pattern, that means absence of the RS pattern or presence of the positive or negative concordance, more likely the VT. This some data, this show the specificity or sensitivity, this one. If this is not, that means there is a RS pattern is there, then we suggest a more feature of the VT. Then we see the R to S interval, that means more than 100 millisecond, more than 2.5 स्मॉल स्क्वायर. अगर 2.5 स्मॉल स्क्वायर से ज़्यादा है, PR इंटरवल, सॉरी RS इंटरवल इज ए Brugada sign is positive in the one of the pre-recorded leads is suggestive with the BT. समझे आप, जो साइन था R वेव्स की स्टार्टिंग होने से लेकर जो S का डीप था, S का नेटेड था, दिस वन, यहाँ से यहाँ का टाइम, अगर ये मोर देन 2.5 स्मॉल स्क्वायर है, मोर देन 2.9 स्मॉल, दैट सजेस्टिव द Brugada साइन, एंड Brugada साइन इज ए सजेस्टिव द BT. नहीं है Brugada साइन, देन सी AB dissociation. AB dissociation है तो मोस्ट लाइकली VT. If the AB dissociation is, that means AB dissociation is no AB dissociation, that's we see the another criteria, that means morphology criteria of the BT. That means कि positive concordance, pre-correlated V1 to V6 में देखेंगे कि positive concordance all are wave, या negative concordance all are in S wave. ठीक, in the morphology criteria for VT and the both pre-caudal leads in V1, V2 and V6. If any criteria for suggesting the VT, that this is VT, and otherwise is SVT. And one more is the criteria for this is a Vereckei algorithm. It is almost same For we first we check the AB dissociation. If present, then the VT. If not present, when we see the another criteria is it is the initial R wave in the AVR. In the AVR we see the AVR in AVR lead. If it is a positive R wave, this is a positive. First is a R wave is positive. That is suggested VT. If not, when then we see another criteria like the QRS morphology in the like bundle branch block or fascicular block. If any block is there, then we see the another criteria. If no or absence of the block, then is suggested VT. Another most is the criteria for the VI of VT. It is the criteria for the initial duration of the R wave. This is the criteria. This is VI and this is the VT. That is terminal volume of the R wave or duration of the R wave, and this is initial duration the terminal duration. If the ratio of the VI or VT is more than 1, it is the SVT. And if it is less than 1, that means if it is less than equal to 1, that suggests the VT. Ultimately, the VT suggesting the terminal distance more, that is more than 70 millisecond, and the initial duration is more than 30 seconds is the VT. Ultimately, the ratio of the VT, that means the अगर इसमें mostly the overall कहेंगे इसमें कि initial duration if is less as compared to the terminal duration is the suggestive of VT. This one, initial and terminal issue, if it less initial duration, that suggestive VT, otherwise is SVT. Okay, got it. Thank you for watching and your kindly presence. Thank you.